Okay, so we had a very interesting session on prevention starting from womb to adolescence. One of the presenters showed us that premature children already have dysfunction, somehow dysfunctional heart. And when they turn into adolescents or even young adults, age 20, when they start doing exercise testing, their capacity is already lower than the others. So already what you suffered in a way in the womb translates into a lower cardiovascular fitness 20 years afterwards. There was also several studies showing that children born with a high weight or with a low weight have their vessels which do not dilate and contract as the other ones. So already in very young children, less than 4, we have arterial dysfunction in the vessels of the retina. And then there was another speaker showing that young children, age 5 to 6, well, 0% of them eat enough vegetables, and only 1 out of 5 eats enough fruit. But what is interesting is that we can reverse this trend simply by being say, true to children. If you really tell the children that this is tasty, this is a nice, this is something that you're gonna like, they're going to like it. And we should show the children the true image of an apple, a pear, a broccoli, rather than an animated one. Because the animated one is fun for the child, but he's not gonna eat an animated vegetable, but he's gonna eat a real broccoli. So there's some hope that we can reverse the trend of junk or unhealthy eating in children. And finally, some disappointing results from studies trying to prevent diabetes or gestational diabetes in pregnant women. A study made a very intensive training of pregnant women, and they tried to see if it impacted the children or if it also impacted the women. It did, but to a very small extent, and of course you can't ask a pregnant woman to train 30 minutes daily or to run for several minutes every day. And so there's some rethinking, what should we do? And one possibility is even before conception. So it's not even starting in the womb. Perhaps even before conception, women should prepare themselves, should be fit and stay fit during the pregnancy so they can have fit or fitter children. And then it goes all the lifetime. The objective is to, let's say, prevent the occurrence of anything bad. Let's delay it the more we can. And well, some optimistic views for the marketing of healthy foods, some rather disappointing news from intervention studies in pregnant women, but it was a very interesting, a very provocative, and let's say much food for thought. And perhaps we must rethink the way we are acting in pregnant women, the way we are acting among the children to promote a healthy cardiovascular status.